we always see celebrity either endorsement or the shunning of plastic surgery, botched jobs, things like that. We'll say quote unquote botched jobs in the news. And so I think what we wanted to do today was kind of talk about some of the current celebrities that are in the news. And then we can kind of go over and say, is this real? Is it fake? Is this a common thing? Would I recommend it? And so on and so forth.
And we've been doing this for the last 15 years. Our 15-year anniversary is in a couple months that we've been in practice. And a lot of different publications have come to us and said, hey, look at Shania Twain's transformation. What do you see here? Or, there's been hundreds over the years, and we've been in all the different magazines. But today we're just kind of going to talk to you and brainstorm about what we think and our thoughts of what has been done, what could have made it better or worse, and what you can learn from some of the celebrities' mistakes or actually successes.
So the first one that I definitely want to talk about, for me, listen, I applaud, we'll discuss Charlie Sheen and his transformation. And I want to applaud him, first of all, for being vocal, because ultimately, these actors that we've known forever, you see them age, and some of them age out of our ideal of what we want them to look like, right? But they're human, just like the rest of us. And so there's only so much lighting can do. And that's where sometimes people need help. And it's always been kind of a secret thing in Hollywood. A lot of the celebs, how many celebs have we seen that no one will ever know? One, because we like to think that it's good work, and two is because they don't want anyone to know.
And it kind of goes as like this, right? The A-list celebs, super hush-hush. You have to close the office, make sure nobody sees them come in and out, and you obviously respect their privacy. Then you go down to the B and C-list actors, and now the world of reality TV and, music stars and things like that. And it's a little different. Some of them actually want to publicize it. So I think that's where you're getting at. Interesting part about Charlie Sheen, I'm just going to take a really quick little tangent, is his father aged really gracefully all the way through. And it's interesting because generations change over and over, so the older set of, especially male actors, especially, A-list actors, rarely really did much. They just aged, and then they got the roles that really fit their part, right?
You're right. Like, look at Kevin Costner, look at Clint Eastwood.
Absolutely. Michael Douglas.
Yeah.
These people age and they're older, but they're still, they kind of own it and they're doing great,
Yes. Where I do understand it, however, is when you're playing the same role. So 2.5 Men, or let's say, his new show, Bookie. The idea is, you're trying to play a character that's a certain age.
Sure.
And let's say the season goes remarkably well. Well, everybody sees you as that moment, that image in time. And so, look.
That's where the magicians come in.
Yeah. Listen, let's preface it by saying that I applaud him for being vocal, honest, and completely transparent about, improving your looks, right? I'm very curious about the option that he chose, because I will tell you, we have performed thread lifts. We have performed these mini non-invasive sort of procedures. And my take on this, and you can give your own opinion, but my take on some of these things is that you're kind of doing it halfway, and you want to avoid the stigma of undergoing a procedure, but sometimes it doesn't necessarily lead to the optimal result.
I completely agree with you. And that's why one thing I tell everyone, and I tell them, I said, listen, I'm biased. I think you're as good as they get for facial rejuvenation, for facelifts and rhinoplasties and anything that has to do with the face, because you can give someone all of the options. It's not like someone's going to come to you and you're going to say, oh, I can't do a deep plane, or I can't do a SMAS, or I can't. You can do them all. Problem is, a lot of the practitioners out there are, the whole adage of, hey, if you have a nail, everything is a hammer. Yeah, if you don't know how to do a procedure, you're not going to do it. And I think sometimes what ends up happening, it becomes either piecemealed or the wrong procedures done because of gimmicks, in a sense, that They give a name to this. It's a one-stitch facelift, or it's the lunchtime facelift, or it's the no downtime facelift. There's so many different ones. I think there's a name for this one too we'll talk about. But they don't last, and they don't look really that great.
I'm going to go over this. And again, this is no disrespect to the surgeons who have performed this. Obviously, sometimes a surgeon is under certain constraints from the patient. They say, look, I don't want this full procedure, and you just can't convince them. Okay, so sometimes you do have to perform some of these minimally invasive things. So he did choose to go to these two surgeons. One is a board-certified plastic surgeon. One is a board-certified maxillofacial surgeon. The names are Dr. Jan Trokel and Dr. Yuli Gordiski. And he underwent, I love some of the gimmicky names and things like that, because ultimately, listen, it's smart. It kind of sets you apart. If you look at Chachikeo and he's got the ponytail lift. Sure. If you look at Ben Talley, he's got the aura lift. These are all, Chachi's a little different. Those are, and recently published, those are different techniques to access, but they're ultimately doing the same thing, right? We're getting into deep planes.
Yeah, and Ben says that it goes down to the clavicles. So everyone's got their little extra
a little take on it.
Yes.
Each person, each surgeon kind of develops this procedure on their own. But, neither here nor there. These procedures, so he underwent what they called the Y lift, so the Surgery lift. And they call it also known as a closed facelift. Here is my critique. My critique is that they showed a photo at 3 weeks post-op. First of all, at 3 weeks, things are a little swollen. The stitches haven't quite set in. And so you cannot judge a result by 3 weeks.
Never. For anything. Not as a breast, body, face, nose, ear.
At least give me 6 months.
Yes.
A year would be ideal, but at least give me 6 months, because that's when a lot of our stitches, at 6 weeks and 3 months some of our stitches dissolve. And then you want to see, does scar tissue actually hold up?
Sure.
And so there is a similar procedure that Dr. Greg Miller has, my Elevate, and, this was a procedure that was described originally. So let's say the Y lift is two separate things. One, they're performing some type of closed facelift. Again, I can tell you right now, one of the main issues with aging and needing to rejuvenate, make something look natural is excess skin. And until you can do something to reduce that skin, that excess, sometimes you get bunching, and it may look good in repose when you're not making an expression, but when you smile and things like that, that's where, a lot of times the threads didn't work out well, right? Because when you animate, all of a sudden you can see something and it just didn't look great. I can tell you right now that the longevity aspect of a closed facelift without removing some excess skin is going to be pretty minimal, right? And so the second thing they do, they call it a G-stitch neck suspension. Listen, the Giampapa suture has been described for decades.
Yeah, at least 30 years.
And this was a stitch that kind of went from behind the ear, under the neck, and to the other ear. And essentially what it did is it kind of tented up the platysmal bands and gave a better contour to the neck. A lot of complaints on that procedure because people felt choked. It was a permanent stitch. Obviously, if it got infected, we were in trouble.
And Greg kind of perfected it with his little guide wire with the light and everything else.
So instead of being a single suture that goes back and forth, 1 or 2 times, the My Elevate was something different, where it created almost a mattress or a suspension net underneath the neck. And so the difference is Greg still does an open facelift, but instead of opening the neck, he chooses to do that on some of his patients.
Absolutely.
Right?
Which is an option. Again, it's a good option, but it shouldn't be the go-to.
Yeah. And when I look at the before and afters from Charlie Sheen, I don't necessarily see a huge difference in the jawline. Now, we do see that the muscular bands have been reduced, but you still kind of see, you don't see as sharp of an angle. Listen, when Charlie Sheen was 30 years old, he had a sharp jawline, and I don't really see that here. I know it's 3 months and there's still going to be some swelling, but the idea is, again, I'm looking at longevity. And so if you have a particular patient that says, look, I'm fine with looking good for a couple of years and then we have to address this, great, and you can undergo these types of procedures. But for me, my opinion is if you're going to do it right. We're performing these types of deeper plane facelifts earlier and earlier because they look natural, they last longer. And so I think even for the actors, and again, there is some downtime. And so if you're going to be transparent about it,
just do it.
Just do it. You've got the downtime. You've told everybody. And now, that 3-week result that you've posted, not only does that look better than here, but you can be sure that 6 months from now, it's still going to hold up.
And the interesting part is a facelift procedure isn't like it was years ago. Deep plane facelifts are a lot easier to tolerate. They're not as painful. The downtime is not as much depending on how old you are. Obviously, the younger you are, it's going to be easier to recover from, but it lasts. The key is it lasts longer. So if you're going to put yourself through a procedure, do something that's going to last at least 10 years.
Yeah.
So Charlie, thanks for coming out though. That's pretty cool.
Yeah. Well appreciated for all the males out there who are looking to rejuvenate. And so, I think there's nothing wrong with it. I mean, if our female counterparts are going to look younger and younger, there's no reason why we can't either. The next one in the news that we saw, Jennifer Aniston. So she's been in the news because someone recently saw her coming out of a plastic surgeon's office and she had some puffiness under the eyes. And then when you look really closely, this is one of the most common complications associated with under eye filler, right? So let's
say that it's an absolute no-no. You should never do this. Let's really talk about this because I don't think it's an absolute no-no, but it should be really chosen. You should be very selective on who you do this for.
I would be lying if I said I didn't have this complication myself.
Me too.
The idea is this. There is, the cheek slowly separates from the lower eyelid as we age because the cheek falls and then you start seeing a deep trough. You can get bags under the eyes. And, so the common go-to, especially if surgery is not in your armamentarium, is to try to fill that trough, right? So imagine you've got bags under the eyes, the cheek is falling a little, there's a separation with a trough. If you fill that trough, instead of peak, trough, peak, now it's smooth all the way through. You see, less of that deeper line and you look younger. The problem is the puffiness under the eyes. So let's say the bags under the eyes that normally form as we age. There is a specific ligament that's called orbital retaining ligament that attaches to the skull. So it's right where the orbicularis muscle ends. And imagine it's like a hammock. The eyeball is surrounded by fat and the hammock slowly weakens over time. And that bulging fat tends to push outward. So, for us, we say, all right, well, the easiest thing to do is to make hidden incisions under the eyelid, inside the eyelid, and you pull out some of that bulging fat and then kind of laser over the top to tighten up some of the skin. If you do not want surgery, or let's say you're not ready for surgery, or it's a tiny little hint, then filler can be a great option. The problem is when you pierce that ligament. So let's say you're not using a cannula, you're just using a needle.
Which is an absolute no-no.
Yeah, I mean, look, in an experienced injector, they can control many different things, right?
Yeah.
But if you happen to pierce through that ligament into where that bulging fat is around the eye, and you get filler trapped in there, it is a nightmare to reduce because there are no lymphatics. So it's not like it can escape. I've seen filler under the eyes for 7 years.
Yes. And that's why people are like, no, it's going to dissolve. No, if it's put in the wrong place, it's never going to go away.
There's no way your body can absorb it. And so, that's why, and you can even pierce it with a cannula.
Of course you can.
But it's just, you have a lower risk of doing that because it's a blunt tip needle. And so here's what happened to Jennifer Aniston. She had some under eye filler, probably to, fill in that little trough that we talked about. Pierced through that ligament, and now we're stuck. We've got that puffiness. The other thing you don't realize is this, and an experienced injector knows this. For the under eyes especially, you never treat to perfection, right? Always undertreat because everyone is different. And usually what happens is that hyaluronic acid will draw in water. So now let's say you treat it, it looks absolutely perfect. They leave the office and all of a sudden it absorbs water. It's going to look puffy. Mm-hmm. Now, one of the easy fixes is to essentially, like you're kneading dough, you just roll that water over to the lateral aspect of the eye, and sometimes that can eliminate some of it. But you have to come back to the plastic surgeon's office and get hyaluronidase injections to eat it up, and sometimes you have to do 5-6 injections every 2 weeks.
And sometimes it doesn't even go away.
You're right.
And the key, even the more important thing is this. Always like Dr. Layke said, less is more. Number one.
Yep.
Less is way more. You have to be the perfect candidate.
Yeah.
You can't need a lower eyelid surgery with huge bags and try to cover it up. It just doesn't work. I've done it for people because they're like, I don't have money for surgery, just make me look better. And it's looked better, but it's not perfection.
Yeah.
You've got to use the right filler. That's another one. It's got to be a very thin filler, because if not, you get something called the Tyndall effect, which Jennifer Aniston might have had, which is a little bit of a bluish hue of a light reflection off of the filler.
Light comes through the skin onto the filler, reflects blue, and that skin is very thin, so you see that bluish hue. And so some people say, look, I didn't have dark circles under my eyes before the filler, and now I do. That's why. So we like to use hyaluronic acid products that have the least amount of Tyndall effect. And I don't know about you, the Juvederm products, there are several across the board. I tend to like Reviness Versa. It's a volumizer, believe it or not, but you use tiny little bits. And for me, it has it's less hydrophilic, so it doesn't draw in water. And I've never seen a Tyndall effect.
See, I love that for the lips, but I've always used Belotero because it's kind of made for the under eyes, so I liked it. But again, I think if you're going to get under eye filler, if you don't want to run into this problem that Jennifer Aniston had, number one, make sure you're the right candidate. Number two, go to the person who does these a lot, because there is a very, 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 very rare complication of blindness. And that's if the filler goes into the wrong blood vessel, unfortunately. It can happen. And the other thing is there are other options. So other options for what's called the tear trough deformity, or dark circles under the eyes, or just that tired look. Now, interesting part is Dr. Layke does this on a regular basis. How do you work people up when they come in and they say, can you just fix this real quick? Because that's probably what happened to Jennifer Aniston. She probably went into a provider and said, this really bothers me. And immediately they're like, all right, I'm going to put some filler in there.
Yeah.
Whereas really it's the wrong way to go. You should probably start with, when you do better,
good, better,
best, but go best, better, and then good.
Just for the celebs too, you have to offer those three options: good, better, best. And so if you say, look, this can look good, but it's not ideal. Something can look better. Best, obviously surgical, no doubt, just because, we know it's reproducible. And they have to understand that. And so when I give percentages, we'll say, all right, good is going to make you look 15% better. That's significant.
Yeah.
Better will make you look 25% better. Best is going to be 80% better. There's never 100% because there's always room for how you heal and things like that. But 80% is a pretty significant jump. So I always say, look, let's say we have other options for filler that can be more natural. It's not going to be as big of a volume. Again, if I inject 1 cc of hyaluronic acid, you have 1 cc that's going to be in there. We have other options. Sometimes you can use things called PRP or PRF. This is platelet-rich plasma. This is a platelet-rich fraction, SVF, or stromal vascular fraction. This is essentially pulling it from your blood, and then we centrifuge it, and then we inject it back into the body. And sometimes you can have a slow volumizer, and so that may be a little better. If it gets trapped, we don't worry that there's too much volume in a particular area because it's your own body.
And it's funny that you say that, because most celebrities that I've treated for this rather have less of a correction than a total correction, because they say, if people don't realize I did anything, I prefer that.
Yep.
So we've done PRP for some big names in the business, and they're like, if it doesn't do anything, it doesn't do anything. If it fixes it, it's natural.
Yep.
And they go their own way, so you don't get into trouble and you're not on the cover of every tabloid.
Yeah. Then the other option would be to use nanofat. I mean, fat injections under the eyes can have their own complications too, right? It has to be done judiciously, because if you add too much fat, the person gains weight. Well, guess what? That's going to be a puffiness you cannot eliminate. I have a current patient now that I'm taking to surgery because she had fat grafting under the eyes, and on one side it was just too much fat that was placed. And so you can inject whatever you want. It'll reduce it slightly, but that fat was injected elsewhere. And it's not that the surgeon did something wrong. It's that, again, sometimes you get a little overzealous. I would rather undertreat than over, because you can always add more. You can't take it away. And so that's where we use nanofat, which we have a special system. And nanofat ultimately is you take fat cells, you burst, or you disrupt them by sending them through the system, and it's applied as a liquid. But we use it for its stem cell regenerative potential, and some of the growth factors that are within it. And so when you apply it, imagine it's kind of like reversing the clock in that area. So it's not necessarily a volumizer per se, but let's say it restores some of the things that you're losing. Well, it's going to look younger. Mm-hmm. So those are some of the options that I would recommend.
Then surgically?
Yep. Then I love calling it the trifecta, because as we said before, there's puffiness under the eyes. The cheek separates. And, so we're looking at puffiness, volume loss, and excess skin, right? So the three things in this trifecta is through a hidden incision on the inside the eyelid, we remove some of the puffiness, remove some of that fat. The second thing I'll do is, and it sounds counterintuitive, I'll add fat in an area that is necessary. Almost like if I have to say a particular shape, it will be almost like the Nike swoosh symbol around the lower eyelid, cheek, central cheek, and out to the cheekbone.
All the way across.
And then lastly, you got to do something for the skin, because if you have puffy eyes, you remove that volume. Now I've just replaced it with wrinkles. Again, I don't want to put an accordion there. So what you do is you CO2 laser or microneedle or do something to help tighten up that skin, because I don't want to trade one defect for the other.
And that's really should be standard of care. Like that is the treatment for it. You take out the fat so the bulge is gone. You put in a little bit so the trough is gone, and then you tighten skin. Some people do it with different methods, like some people use TCA peels, but the gold standard is to do that. And in my opinion, and I think that, I've seen enough of your patients, that you're talking about a 10-day downtime that's going to change your appearance probably more than just about anything you can do. I'll never forget the gal that we did surgery on. We did body contouring, did her breasts, did her arms, did her legs, did everything. One day she came in, sat across from me, and she said, "Okay, doc, I've never asked you this question, but what's one procedure you do for me?" I go, "But we've done everything." She goes, No. What else? I go, "Do your under eyes." And you know who I'm talking about. And you did her under eyes. She looks 25 years young. She's like, "Why don't you tell me this before?" I go, "Because we don't like to necessarily tell people
exactly. It's a loaded question.
But it really is. It changes, and especially on some younger individuals that are like in their 40s, that everyone's like, "Oh my God, you look so tired all the time." So for Jennifer Aniston, who's a beautiful woman, but not in her 40s anymore, she wanted that quick fix. And I think, honestly, just go and get surgery. It'll be easier. Fix the under eye bags and be done.
Yeah, I agree with you. I think, and it's not necessarily an age thing anymore.
Nope.
I think what we're realizing more and more, and it works in your favor, is for some people who have a genetic predisposition to puffy under eyes or lower brows or hooded eye, things like that, is that you can perform these procedures in younger individuals and it lasts much longer, because you're never going to have as much collagen as you do at that age. And so the results last much longer.
And most of the time, the under eye bags are one of those things that they don't necessarily come back to the same degree as they ever were before. So revision, lower blepharoplasty is not something that you speak about regularly.
The next one I wanted to get to, this is kind of a funny one. I think, it's a little bit of a farce, but Jackass's SteveO is planning on undergoing, as part of a bet, planning on undergoing a breast augmentation.
He's not transitioning.
No.
This is just a bet.
Oh, there's just, yep. And so, he knows that afterwards he has to keep them in for a certain amount of time. And, he talked about, it's basically for a comedy bit. So he's 50 years old and he literally went under surgery on July 3rd. All right. And so, that is definite commitment right there. And then he's wearing them for a maximum of 2 months, and then they're coming out. I'm so interested.
I just want to know who's doing it.
Exactly.
That's a tough one, man.
That's a real tough one.
I know that I would probably have a hard time doing this for anyone.
Yep.
It's just not my style. But God bless whoever's doing it. And this is just weird.
Yeah,
this is just really strange to me.
The interesting part is that he's actually going under the muscle. So they are going to, they're going to separate the inferior aspect of the pectoralis muscle to put the implant under the muscle. Again, I agree with you. There's no way I would do this. This is you're deliberately harming someone, even if it's temporary.
It's crazy. It's interesting. He's quoted here as saying, "I've always been a body modification guy, like with my back tattoo and my butt piercing.
Yep.
Body modification has always been part of my deal. This is different, man. This is surgery." And I think that people need to realize that there's still risks associated with surgical procedures, and it shouldn't be done for a bet. That's just the way I look at it.
Yeah, listen, I understand the comedic aspect, but it's the comedic aspect. For anyone who's ever seen Johnny Knoxville and this whole crew, I mean, they are absolutely insane, and some of it is so funny. But this may be a little
what he should do, I think? Instead of actually getting a breast augmentation, he should do that like the weekend breast aug, where they fill him up with saline. So I think we talked about it in one of the podcasts. There's this guy in Manhattan that was doing weekend breast augs for people. He'd bring them into the office. He'd fill their chest up circumferentially where their breasts were with saline, which is just salt water. And it would last for about 72 hours. So someone was going to a gala, wanted to wear a breast with a little bit bigger bust, they can do that. He should probably do the same thing.
Yeah.
Easier way to get away from it.
I think he had to keep it in for a certain amount of time, but
oh my God.
In any case, look,
my God.
This is what's in the news. We at least wanted to have a podcast where we address some of the current things in the news. So the takeaways, I think, if you are considering doing something, do it right. Look at all the options, and we talk about longevity because that's obviously going to be, something to consider before you undergo a particular procedure. And, we talked about lower eye fillers. You got to be careful with those. Go to someone who is very experienced and knows what to do when you run into an issue. And consider surgery if you're a borderline candidate. You may want to go with the more optimal best because it's going to last longer. You don't have to keep undergoing injections every year or 6 months. And if you are going to do it, then I would say, less is more. Have the provider undertreat. And then lastly, for SteveO, I mean, we'll see what this holds. Like this video? Well, I think you're going to like this one too. I'm a little disheartened at some point when she denies having a rhinoplasty, because when you look at older photos, clearly from then to now, and again, I think she's absolutely beautiful. She's just, she's maintaining very well. But, from the lip filler to the rhinoplasty, I think we can clearly tell